Did you know there are over 1.1 million people living in the United States with HIV, and 20% of them don't know they're infected? In 2006, National Public Health Guidelines recommended that all adults be tested for HIV as a part of routine medical care, regardless of whether or not they think they're at risk.
Hi, Mr. Jones.
Hey.
My name is Judy. I'm actually going to ask a couple of questions before the nurse practitioner Ann comes in to see you.
Okay.
Okay. I will be referring to my paper just to make sure that I'm able to address all questions. Are you okay with that?
That's fine.
Okay. So how are you doing? And do you have any concerns today?
I mean, I'm doing fine. I don't think I do. I have thyroid problems and high cholesterol, but I've been exercising and watching my diet. My doctor asked me to do that, and I've lost a couple pounds, so I feel pretty good.
Okay. That's good to hear.
Well, there is one thing. My wife mentioned to me that one of our old friends has got HIV. And I was thinking, you know, if a good guy like him has got it, I might have it too. So that got me a little bit concerned.
Well, let's see. There are a couple of questions I need to ask right now. And with that, it may be a little touchy. So do you mind answering these questions?
No, that's fine.
Okay. The first question is, how long have you been married?
About 15 years now.
And how many sexual partners have you had?
About 3, but only my wife since we've been married.
Okay. What about any drug use of any kind or any IV drug use?
No, I tried pot when I was younger, but that was a long time ago and nothing since then.
This next question is kind of personal. And I just want to make sure that it's okay with you for me to ask this.
Sure.
Have you ever had any sexual transmitted disease or had sex with another male?
With another man? No.
No?
I mean, I had gonorrhea when I was younger, but that was a long time ago and nothing that I know of since then.
Okay. Well, based on your answers, you're not a high risk for HIV and don't need to worry about getting tested. I will take your information back to Ann, the nurse practitioner. Do you mind changing into your gown?
No, that's fine.
Okay.
HIV testing within the VA system is completely confidential and voluntary. While we recommend that you receive an HIV test as a part of your routine lab work, we will not test you without your permission. Your VA benefits will not be affected in any way by your decision to test or the results of your test. While we recommend that you are tested for HIV, the decision is completely up to you.
Hey Judy, is Mr. Jones here yet?
Yes, he's in room 3. By the way, he's been asking several questions about HIV testing, and based on his answers, I told him that he doesn't seem like he's at high risk and need to be worried.
We're trying to get away from using the term high risk with our HIV testing policies. Anyone who comes in contact with body fluids or blood from a HIV positive patient can actually contract the disease. And the danger is that they will pass it on to someone without even knowing, because they may not even exhibit signs and symptoms of the disease. So at the VA, we're encouraging all of our veterans, when they come in for appointments, to be tested for HIV at least once, and then more often if their lifestyle indicates a need for it. That way we can get them treated earlier than otherwise if they hadn't been tested.
Wow. I could never imagine if someone's not engaging in high-risk behaviors that they would ever need to be tested. That's great news.
It is good news. It's good for our veterans, and I'll be glad to explain to Mr. Jones when I go in, and I'll talk to him about the new HIV standards.
Okay, I'll let her know. By the way, do you know what the HIV consent form is, just in case he wants it, because I cannot find it anywhere?
We actually don't require written consent anymore. We only need a verbal consent from the patient, and it needs to be obtained by a licensed provider.
Thank you.
The VA recommends that voluntary HIV screening be offered to all veterans receiving medical care, even for those veterans who do not think they're at risk. That way, infected veterans can be diagnosed early and receive the most benefits from treatment. If you haven't asked if you want to be tested, be brave and ask for the HIV test.